We're going to go ahead and get started. Good afternoon, everybody, and welcome to our webinar today on school and childcare roster lookup. Squirrel is what we like to call it. We'll be covering what it is, what is Squirrel, and how to use it. Today is Friday, April 28th, 2023. We will be convening today from 12 p.m. to 1 p.m. Pacific time. And on behalf of our team here at CDPH, California Department of Public Health, I want to thank you for joining during your lunch hour to learn about this new exciting tool, Squirrel. And just as a quick introduction, I am Ahana Singh, School Locate Vaccination Coordinator at CDPH. We'll be spending this hour we have together learning about the Squirrel tool that we have, which is a new product that is evolving and is hopefully making it easier to understand whether children and students meet immunization requirements for school or childcare entry. Alrighty, and just to quickly go over housekeeping notes that we have here, please note that all lines are muted. We will not be monitoring the chat, unfortunately, but if you do have any questions, please feel free to use the Q&A box instead. And we'll do our best to answer them today, but there's going to be a lot of us, so we will try to address those at a later time. We'll be conducting FAQ, we'll be creating that, or we'll be addressing that during office hours the month of May, and more information on that later. The transcription feature, thank you. The transcription feature is currently activated and available for use. So if you need that, please feel free to go ahead and use that. And then lastly, all sessions will be recorded and posted to the California Immunization Coalition website, www.immunizeca.org, as well as the CIC YouTube page. And I think I forgot to mention a quick note that this webinar here today was a collaboration with the California Immunization Coalition, or CIC. So I want to thank our colleagues here at CIC for their collaboration. Next. And again, just to quickly go over our program here today, this is our third session of the webinar on Squirrel. The first one was local health jurisdictions, LHJs, which was this past Monday, April 24th. And then we had schools, K-12 school sites, which was on Wednesday, April 26th. And today is childcare and pre-K sites, Friday, April 28th. And just to make sure that we all know that registration was tailored to each audience. So folks may be attending today who are not part of the childcare pre-K sites, and really just want to make sure that that's okay. If this is the case and they would like more information or detail on a topic covered today, we advise you to check the recording for the respective audience once it's posted online. And follow-up correspondence will be sent out regarding this as well. So please be aware that content and demos are slightly modified for the different audiences. And so quickly go over agenda today. I will be passing it off to our executive director at CIC, Catherine Flores, to cover a little bit more about the California Immunization Coalition. And then from there, we'll go over with California systems, laws, policies related to school vaccination. And then after that, something I'm sure we are all waiting for, demonstration of Squirrel with our colleague Alana Hintz, Senior Project Manager at M-Corp. And then we'll do a little bit of Q&A, questions review with our colleague Naveen Makdoom at CDPH. And then I will close it off again with office hours, information on the evaluation, and then wrap up before adjourning. So without further ado, I will pass it off to Catherine.
Thank you very much. And good morning, everyone. Good afternoon, everyone. Yes, Catherine Flores, Executive Director for the California Immunization Coalition, next. And we are a statewide nonprofit 501c3 organization. And as you see here at our website, immunizeca.org, our goal is similar to yours, make sure that all Californians are protected against disease, disability, and death. And you have a very unique charge and role in protecting Californians because you have the youngest, most vulnerable Californians in your charge. So it sort of starts with you. And so we're very excited to have all of you folks on the call today, and we look forward to your feedback. Next. Most of what we do revolves around advocacy and education. When I first started, we had all sorts of, goals and committees and aspirations and about how we can make our vaccination rates higher in California, because believe me, they were not this great in the olden days, 25, 30 years ago. Had a lot of work to do, and we still do. But what it comes down to is our work around advocating for strong vaccination laws that are going to protect our children, adolescents, and adults, and laws that will make sure our communities have access, whatever form that takes, whether it's insurance access, vaccination coverage on insurance, which has happened finally, whether it's making sure you have access to physicians and knowledge in terms of access to knowledge about the vaccines, making sure our parents understand. So that's what it's about for us, is the advocacy to make sure we have good policies and protect the good laws that we do have in California. And then education. The education we primarily focus on is around educating healthcare providers, school health providers, childcare providers, where we can partner with you, to make sure you have the resources and information necessary to inform yourselves and inform your families and parents, which is just so key now. I know there's so many more questions that parents have than they had in the past, and they rely on their healthcare providers. That's who we want them to ask, but they also rely on you to know the laws, the rules, and about vaccination. So you're a huge part of the team, and we deeply appreciate you being here today. So we try to lead you to the best resources, what we consider the best resources at the CDC, at the California Department of Public Health, and a ton of other folks that are working on this together. So what we do is, again, trying to improve immunization rates for Californians of all ages. And we'd also work with other states and other partners nationally, because we know, unfortunately, the diseases don't stay here. The germs are transmitted nationally, internationally. We've seen that play out right here in California with measles in the past and pertussis outbreaks, and we see it happening in other states. So we know all we can kind of focus on is California in this moment, but we know that what we do here can positively impact the health of other states and health of other countries. So, and protecting us protects others. We encourage community-based advocacy, and we work very closely with our local immunization coalitions in California. We have about a dozen right now. It waxes and wanes. We used to have about 18 or so, but right now we've got about 12 or so solid coalitions and folks that are working to develop coalitions in California to make sure that we are addressing the needs of local communities, to make sure we are hearing from the local communities, and that the local coalitions and communities have the resources that we might be able to provide. And again, as I said earlier, educational opportunities for healthcare providers and providers such as yourself. And throughout all of this, the California Immunization Coalition has always supported the California Immunization Registry, or CARE, because we've known since the beginning, since it started, even though it's been a long process to where it is now, we know that this is the way we can not only raise immunization rates, but we can protect our communities even better by knowing how well they're immunized and where our pockets of need are, where we need to pay more attention to, where we need to give more resources to, when we can see how well our community is immunized. During the pandemic, they were always important in our book, but now the community in California and our policymakers, I think, are much clearer about how important the registry is. And based on this turnout and the turnout we've had on our other programs this week, we can see that it's very important to yourselves as well. So we're really looking forward to sharing this information with you today. Next slide. We're here on social media a lot, and it's been a challenge to get on social media. Number one, it's kind of a challenge anyway on some platforms, but I think it's really important still to stay in touch with each other as professionals and to get ideas and share information. So we're not on there sharing nonsense. We're on there sharing information and resources. Once in a while, I get a little cheeky, but mostly it's all resources and information. Lastly, we've worked with the California Department of Public Health throughout CIC's existence. Before we were Childhood Coalition, we merged with the Adult Coalition. Now we're one big happy California Immunization Coalition. But throughout, we've worked with partners at the California Department of Public Health. And what I've told our other previous audiences is that we see this as from the long view. the registry started off small. It started off with a couple providers, a couple counties, and it's grown so much. And we're seeing so much growth, a lot of growth in the last couple of years. And so what we envision is coming to pass, a fully functioning statewide registry that's going to work for all of us. And so we thank you for all you do to take care of our, as I said, most adorable, vulnerable, and special children in California. And if we can ever assist you with resources, or if you are in a leadership position or running a child care center and you'd like to partner with us on some sort of an educational event, or want to make sure we have information or can share information for you, again, related to immunizations, happy to talk to you at our info@immunizedca.org email. So now I will hand it off to my colleague, Amy Pine.
Thank you so much, Catherine. And again, thank you to the California Immunization Coalition, not only for providing all of the logistics for these webinars, but just for being such an outstanding partner for so many years in the world of immunizations. My name is Amy Pine. I work here at the California Department of Public Health. I'm the School Vaccination Team co-lead, and I am here to set the contextual stage for what the systems are that are in place in California to support immunization requirements for childcare entry. And I'm going to take myself off video because I'm more nervous when I can see myself. So I am going to be speaking about these different systems and this alphabet soup. So the first acronym that Catherine was just talking about was the California Immunization Registry. CARE, also known as CARE 2. I'm using CARE and CARE 2 synonymously. The California Immunization Registry is a secure, confidential, statewide computerized immunization information system for all California residents. And California law says that every single administered immunization must be entered into an immunization information system. For some folks in the Central Valley in California, that means the RIDE system. And for outside of the Central Valley, that means CARE. The good news about those who enter doses into the RIDE system communicates with CARE in almost real time. So all doses that end up in RIDE also end up in CARE. And there was a law that went into effect January 1st of this year, Assembly Bill 1797, that makes it a law that every dose must be entered into an immunization information system. So the next acronym is CARE Hub. CARE Hub is an umbrella platform where schools and childcare sites access applications like the school and childcare roster lookup tool. So CARE Hub is going to be that portal, that overarching entity that houses applications. Right now, the school and childcare roster lookup tool is the only one there, but future enhancements to CARE Hub will include the addition of the CARE medical exemption system and the portal for annual school and childcare immunization reporting. Third acronym on this slide is Squirrel, the school and childcare roster lookup. We like to call it Squirrel because it's fun to say, and also because it let us have this cute little squirrel mascot that we can use. Anyway, the school and childcare roster lookup tool is designed for childcare staff such as yourself to easily determine whether or not students or children who are wanting to enroll meet the immunization requirements for their age and their grade when they are trying to enter. The school and childcare roster lookup tool communicates directly with CARE. So it takes names that you submitted and it asks CARE, the California Immunization Registry, for the all of the immunizations that are in CARE for that student. If I could have next, please. So going a little more into detail just about each of these systems, and I won't spend too much time here, but just to reiterate that the California Immunization Registry is accessible by providers, medical clinicians, local health departments, the Women, Infants, and Children program. And prior to this year, some school and childcare sites had read-only access. So there are many of you probably on this call that got access to care a long time ago, read-only access, and you still have it. But folks who are wanting to, in the childcare and school world, who are just joining this year, do not have read-only access to care. They only have access to the school and childcare roster lookup tool. Care does show all administered doses that have been entered by the provider. And that includes immunizations that are not related to school or childcare law. And the data that is in care will be more robust depending on how long that medical provider has participated in care. If they just started using care, maybe they've only started at a point in time moving forward, and maybe they did not do historical data entry, and there are a lot of providers that just started using it recently because of COVID-19 vaccine, but maybe they've been using it for a long time and have very thorough immunization histories on all of their patients. Care can be used to print out yellow cards, blue cards, or comprehensive histories. Care does feed or power the digital vaccine record, which I'll talk about pretty soon. It's a pretty neat thing. What Care does not have is the ability to easily say, this child is ready or not ready for childcare or school entry. So that's one of the reasons we created Squirrel. Thank you, Cameron, for the next slide here. I just mentioned the digital vaccine record. I just wanted to make sure that you all knew about this nifty thing. It's been recently created also as a result of the pandemic. It started as a COVID vaccine record, but now it includes all vaccinations. It is an electronic vaccination record from the California Immunization Registry that is an official record of the state of California, just like the yellow card. It does include information. It includes a person's name, their date of birth, their vaccination dates, and the vaccines that they've received. It also includes future recommended vaccines and timelines, and it takes information directly from Care. It's a wonderful tool. There is a link to the digital vaccine record on this slide. There's also a link to frequently asked questions. I encourage you all to check it out. I feel like it will replace a lot of families asking doctors' offices for vaccine records, and it will make things much easier for many families. Thank you for this next one, the Care Hub. I already talked about the fact that this is a portal, an umbrella site. This is an image of the homepage of the Care Hub website, and I just wanted to point out with the green arrows, those buttons on this homepage that are most relevant for the school and childcare roster lookup tool. So at the top of this, we've got two green arrows that have to do with registering in Care, and then, in Care Hub, and then signing in to the school and roster lookup tool. The middle button has to do with signing into the school and roster lookup tool. And then the bottom arrow is pointing to how to register and enroll instructions, and also using Squirrel frequently asked questions. So these green arrows are your primary go-to arrows for all things that have to do with Squirrel. And I think that's all I needed to say. I feel like there's something else I wanted to say about this slide, but I'm not remembering. It's okay. Okay, so now back to the school and childcare roster lookup tool. We like to call it Squirrel. It is a tool that makes immunization record checking for you in the childcare world much easier. It takes the pre-kindergarten immunization requirements and communicates with Care to determine which students are complete, which are conditional entrants, and which are overdue. And that's those three categories we'll talk more about as well. It only accesses immunizations related to childcare requirements. And it's something that is usable now. Why Squirrel? Well, it takes the guesswork out of who is eligible for entry and who is not. You do not have to make any calculations for when a conditional entrant might be due for their next doses. It is targeted to the immunizations required for enrolling, and it's a tool to help you accomplish the implementation of requirements and reporting for childcare every year. As we said, it's not yet there, but it will. But Squirrel will be communicating directly with Childcare Reporting Portal in the future. So just making sure, I think everyone on this call knows this, but we did get a lot of questions prior to these webinars that had to do with childcare immunization law. So I just wanted to reiterate the fact that we do have law here in California that says that California schools are required to check immunization records and childcare facilities are required to check immunization records for all new student admissions for pre-kindergarten, kindergarten through 12th and 7th grade entry. And this applies to all students and children, regardless of when they are entering childcare during the school year. Next, please. Oh, thank you. Also in California law, we break down the different statuses of students. California law says to unconditionally admit a pupil whose parent or guardian has provided the documentation of immunization. So to unconditionally admit a student who has received the required immunizations or has a permanent medical exemption, and I will talk a bit more about medical exemptions. The second category is to conditionally admit any pupil who lacks documentation for conditional admission, who lacks documentation for unconditional admission if the pupil has started receiving doses of all the vaccines required for the pupil's grade and is not currently due for any doses at the time of admission, or has a temporary medical exemption for some or all required immunizations. Children in childcare settings, depending on when they begin, I think of them as perpetual conditional entrants. They're constantly adding DTaP, polio, hepatitis B, or Hib doses between the ages of 2 and 14 months. And then they need a dose of MMR and varicella when they hit age 15 months. And it's really hard work keeping track of all those changing doses. And the school and childcare roster lookup tool can help with that. The third category on this slide is overdue. If an 18-month-old is starting childcare and they've not received their MMR or varicella, that child is considered an overdue and they should not be allowed to enroll until they receive those vaccines. So students who are overdue should not be admitted until they receive their required vaccinations. I did speak a little bit about medical exemptions. I'll just reiterate here that there's also a law in California related to medical exemptions. And as of January 1st, 2021, all new medical exemptions must go through a centralized computerized system, which is called the CARE Medical Exemption System. So if you are receiving a medical exemption for a child that is unimmunized and wanting to be in childcare, it needs to come from this CARE Medical Exemption System. There might be some paper medical exemptions still in circulation from prior to 2021. I don't think too many of them are in the childcare world. They're more in the school world, but there could still be some in circulation until the year 2028. We say this a lot in the world of immunizations. You don't have to know the answers to all the questions, but you do need to know where to go to find out the answers. And there is a link on this slide about information related to exemptions. And so it's a good link to know about. It's on the Shots for School website. There also, just to reiterate, that the CARE Medical Exemption System does not yet communicate with the school and childcare roster lookup tool, but that is planned for the future. Okay, I was just saying you don't have to know the answers to all the questions, but you need to know where to go. And this is where you go, the Shots for School website. It has so many resources available for different audiences. You can see from those green arrows, one of the options is childcare, and there are so many tools and they're classified in different categories, broken down. This is an important website for you to bookmark and go to anytime you have questions related to immunization law. I also wanted to point out on the next slide that we have some training modules that are newly produced, also as a result of COVID funding. These have to do with how to become an immunization expert for your school or childcare facility. The number 7 at the bottom of this has specifically to do with immunization reporting, and you all very recently turned in your annual immunization reports. Thank you for that. The rest of these 1 through 6 are actually geared towards schools. It's a lot of very similar information, but because we had to get everything ready for reporting, we had to take a little break in terms of making sure that all of the childcare training modules were finished. So they are still in process, but and they are coming soon. We will inform everyone that's on this call when those childcare training modules are produced, but they will be posted on the Shots for School website, and they are not far away. Okay, coming back just to the life cycle of a school and childcare roster lookup report, I just wanted to quickly take everyone through it, just from like a higher view. There's just basic steps involved, and in our demonstration, we're going to learn all about this. First, you register in Care Hub to use Squirrel. So you start by registering in Care Hub, and then once you have your login and you've registered in Care Hub, then you can sign in to the School and Childcare Roster Lookup tool. And once you've signed in to the tool, you go to your roster management dashboard. Your roster management dashboard becomes your friend. You have 3 different choices from roster management, which is like uploading a roster, creating a roster, and doing a single student lookup. And we'll learn all about that. So after you have signed into your roster management dashboard, you can create a list of all of your students that you want to check up on. You load that list up into Squirrel. Squirrel communicates with Care and then produces a list of student results, meaning are they complete, are they conditional, or are they overdue? And then you, as a childcare facility, works with that report on subsequent actions. Do you need to send out any notices of immunizations needed? Do you need to follow up on conditional entrance? Or do you need to do nothing because your students are complete? And then the next slide just talks a little bit more about the fact that Squirrel does communicate directly with Care and mimics Care. So if an immunization is not in the California Immunization Registry, then it is not going to be in the Squirrel tool. If it is not to be shared in the California Immunization Registry, then it will be locked in the School and Childcare Roster Lookup tool. There are some families who say, no, the only person that I want being able to access my record in California is my doctor's office. I don't even want any other doctor's offices to see it. So that would be considered a locked record. And if you as a childcare site encounter that, then you would have to ask the family to bring in a paper record of their immunizations. So we talked about this a bit already, but if there is data that's not in Squirrel, it probably means that maybe the patient has recently moved to California, haven't registered with the provider yet, or the provider just started using Squirrel, or they never entered historical doses in, the provider just started using Care, or they never entered historical doses in Care. But so, I mean, there are a number of reasons why data might not be in Squirrel, and it has to do with the completeness of the data in Care. If you get a paper record and you see that the Squirrel record are both incomplete, then your options are to say to your family, well, can you please go back to your primary care provider and get a complete record? Or can you please go back to your primary care provider and get immunizations? And then my last slide is just to, again, say that Squirrel is a tool that is available now. We would love for you to register in Care Hub so you can get started using Squirrel. Now's a good time to get familiar with it because it is enrollment season for the fall, and also because we will be putting on office hours in May and have the ability to answer more of your questions. Our intention for the future is for the School and Childcare Roster Lookup tool to replace the Care read-only access option and replace that entirely for childcare sites. but we don't yet have a timeline for when that will happen. When we do basically remove Care 2 access, we will give everyone at least 2 weeks and hopefully 4 weeks notice once we have the date confirmed. I did want to say that nothing will be changing in terms of care permissions for all of the clinical sites out there that are using Care. So all the school-based health programs and clinical sites that are administering vaccines, they do not have read-only access. They have clinic access, and nothing will change in terms of their access. That is all I wanted to say to set the context, and I am now happy to turn things over to Alana Hintz, who is with the M-Corp Corporation. They are the corporation that CDPH contracted with to help create the school and childcare roster lookup tool. I thank you all for your time, and take it away, Alana.
Thank you, Amy. Hello, everyone. My name is Alana Hintz, and I am a senior project manager with M-Corp, and today I will be doing a demonstration of Squirrel. Next. Welcome, and thank you for joining us today. We are pleased to be demonstrating the school and childcare roster lookup module in the Care Hub portal. Squirrel is available to childcare facilities to check the immunization status of each child's vaccination schedule. Users can view child immunization statuses online or by downloading an editable report that details which children have not yet met the vaccine requirements and provides guidance on needed vaccines for entry. Next. The contents today that I will be covering in Squirrel are how to register, roster management, and how to use single student lookup. Next. How to register. Setting up an account takes less than 5 minutes and just your email address and a password you create. Next. To register invited users, step number 1, receive an invitation. To be able to sign into the Care Hub, you must receive an invitation to register via email. If you are an org admin and have not received an invitation, you will be able to register, but when you attempt to sign in, you will be directed to the enrollment page. You will then enroll your organization by filling out the enrollment application. The application then goes through a verification process and approval. Once approved, you will then receive an email invitation and be able to sign in. If you are a child care facility employee and would like to use the Care Hub, please contact your organization administrator. Ask them to enroll in Care Hub and register your organization, and then have them invite you to register. Step number 2, from the Care Hub welcome page, simply click the register button located at the top of the page. Step number 3, agree to the user access agreement. On the website, user access agreement page, read the Care user terms and conditions, and then click the I agree to the user access agreement button. Step number 4, request a verification code. Enter your email address and click the Send Verification Code button. A message appears stating, verification code has been sent to your email inbox. Please note it is important that you use the email address from your invitation to register as shown here. Step number 5, get your verification code. Go to your email account, copy the code from the email that was sent by the system, and then paste the code into the verification code field, and then simply click Verify on the Verify Code button. Step number 6, create a password. Enter your password in both the new password and the Confirm New Password field. Then click on the Create button. You are then taken to the Welcome to Care Hub screen. Once you have completed all these steps, simply log in, set up your user profile. You will then be taken to the School and Child Care Roster Lookup. Now I will be sharing my screen to demonstrate the roster management feature. Users can upload a roster file or build one from a template we provide to request the children's immunization data from Care2. Care2 will return the information on children who have records in the registry, and Squirrel then calculates any required vaccines that are overdue or conditionally met, giving the user an indicator of whether the child is complete on the necessary vaccines to enroll in a child care facility. From the roster management page, users can upload a roster file, build a roster, or search for a single student. Users can click on the Upload a Roster File button to upload a CSV file. You can build a file or use the template accessible via the Learn More link here. The CSV file needs to include the following required fields: the child's first and last name, date of birth, grade, and student ID to help locate a child in Care2. Users can also add other identifying data, such as the school ID, the middle name, gender, and parent's first name, to support the reporting. For incoming children without a student ID, users may enter any number. Once you have uploaded a file, it will start processing and checking the Care2 immunization registry for the children on your roster and your vaccine status related to childcare entry. Please note that larger files may take a while to process, but you can log off and come back later. The file will keep processing even if you are logged off. You will get an email notification when your file finishes processing. Uploaded file rosters are kept for 1 year from the date added. When your file is fully processed, it will show a status of completed. You can also delete a file at any time by clicking on the red trash can. Here you will want to confirm whether or not you want to delete your file and simply click yes. The file is then deleted from your user file. To view the immunization status of each child on your roster, simply click the name next to your file name. If an exact match is found between the child's information from your roster and Care2, the lookup will show the child's status for each immunization required for childcare entry. The immunization status types include complete, conditional, locked, or overdue, according to the tracking schedule you select, either TK K through 12 or pre-K. We will now view a conditional record. To help you keep track of children who have been admitted conditionally, the file also shows you the date range of when the next dose will be due for the child to be able to meet all immunization requirements. The roster lookup will also identify children who could not be found in the immunization registry. You can try to find the child again by updating or refining your identifying data and re-uploading a new roster. Some children may not have immunizations in the registry, either because their primary care provider does not yet communicate to the registry, or maybe they have just moved and haven't yet established their medical home. When this is the case, you will need to follow up with the child's parents or guardians for the immunization information. We will now view a multi-match record. When the child's information provided on a roster matches more than one record in the immunization registry, select one of the matches to include the record on the report. In this case, I do know that Nathan Wilder is the correct student. I will select his name and simply click OK. The student is then added to your roster. For easy follow-up, users can use the advanced filter feature to filter by vaccine type or to filter on children whose records are locked, not found, or need to be viewed because of multi-matches. From here, you can also delete any children that you do not need to follow up on. This might include children who are fully up to date and do not need any further attention. Simply check the name next to the student you would like to delete and delete. You will get a pop-up asking you to confirm that you want to delete the student and simply click yes. This then deletes the student from your roster. When you are satisfied with how you have arranged your file in terms of filters and children, simply click the download button shown here to save a report as an Excel file to your computer. Squirrel then combines the Care to Compliance report and the Immunization History report. The report offers additional information to assist child care facilities in determining which immunization requirements have yet not been met. The report is easy to read and has color coding. With this report, you can also filter or sort on any field. The report also provides helpful and comprehensive comments on any overdue or conditionally met vaccines. To close the roster management report page, click on the arrow beside the file name. From the roster management page, you can also build a student roster. Here you can manually enter the required information for your child. Step number 1 would be naming your file. Step number 2, enter the last name and all required information for the required fields. Users can also add other identifying data. I will go ahead here and enter student name, last name, first name, the date of birth, and the grade. The system accepts only the following values for grades -5 through 13 and K. Grade values -5, 4, 3, 2, and 1 are pre-K values. For example, -1, 1 year to kindergarten, -2, 2 years to kindergarten, and so on. Once you have entered all your information, simply click the Add to Roster. The child then will show up in the roster section. From here, you have the option to edit or delete a child. When you are satisfied with your entries, you can then click Submit. Squirrel will then request immunization data from Care2. Care2 will return the known child's information. Squirrel then calculates and provides the child's details and status of the vaccine requirements. After clicking the Submit button, note that you have been taken back to the roster management page, and your file can be located under the user files shown here. From the roster management page, you are also able to search for a single student. Enter the required information in the search fields: last name, first name, grade, and date of birth. You can also clear the search details by clicking on the Reset button. This then clears all fields. I will quickly re-enter my student. And then click Search. After clicking the Search button, Squirrel then brings back the child's information details. You can change the tracking schedule by clicking on the drop-down arrow and selecting either pre-K or TK K through 12. To open the child's detailed record, click anywhere in the row. Here you will see the details and status of the vaccine requirements. To view the vaccine history and see the immunization record for this child, click on the Vaccine History tab. The Vaccine History page, you can change the tracking schedule. To view the missing doses for that tracking schedule, note that the default has been set to TK K through 12, and that the missing doses here are showing as polio and DTaP. When I click on the pre-kindergarten tab, tracking schedule, note that the missing doses are now showing as polio and MMR. Here you will also be able to see the child's immunization record, the required vaccines, the date administered, and the series if applicable. From the vaccine history page, you can also print the child's blue card. The blue card opens up as a PDF where you can then download it from your computer or print it. To close the vaccine history page, click on the arrow beside the child's name. The roster management page reopens and your single student lookup details have been cleared. That is the end of my demonstration today, and I would like to thank you all for participating. When a new product such as Squirrel is rolled out, it is always great for us to hear feedback and learn what customers like and if they have any suggestions. You and your colleagues are an important part of that process, and we thank you. We are confident that Squirrel will indeed meet your needs. Thank you again, and I will now be turning it over to Naveen.
Thanks, Alana, and thank you everyone for joining us today. I'm Naveen Makhtoom, Coordinator for School-Located Vaccination Team in the California Department of Public Health. Today, I will be reviewing some frequently asked questions that were sent by all of you. If we don't get time to go over all the questions today, we will cover them in the upcoming office hours in May. So the first question is, are we required to use Squirrel? And the answer to that is, school and childcare sites are not required to use Squirrel, but we hope that you will all want to use it, and the time to register for it is now. Once you have access and know how to use it, it serves as another tool to easily view your students' immunization status. Next question is, can Squirrel print yellow cards? And the response is no. Squirrel can print blue cards, not yellow cards. Squirrel is a tool specifically for school and childcare sites and related immunization information. The California School Immunization Record, that is the blue card, is the only record that school or childcare sites may need to print. If a family is needing a yellow card, they should ask their doctor's office, or they can access it from California's digital vaccine record. Next. What are the required fields for Squirrel? So for uploaded rosters as CSV files, the required fields are student first name, last name, date of birth, student ID, and grade. Please note that student ID is not required for the build a roster function or for single student lookup. Next. Next question is, why is the grade a required field for roster management? And the answer is, the current grade requirement is related to pre-K, transitional kindergarten, kindergarten to 12, and Tdap vaccine requirements. Specifically to Tdap, it must be administered on or after the 7th birthday and must be given before the 7th grade. So if we have no grade, then we cannot determine if grade requirement has been met. Next question is, what if I'm using the single student lookup and I don't know what grade they will be entering? An answer is, if you don't know the grade for an enrolling student and are wanting to use Squirrel, simply estimate based on their age. Next, please. Yeah, so how many people can be registered in Squirrel from a school and childcare site? There is no limit to how many Squirrel users there can be from individual schools or childcare sites. Next question is Squirrel connected to CareMe or the immunization reporting website? And the response is not yet, but there are plans in place for Squirrel to communicate directly with both websites or portals in the future. What should I do if Squirrel shows students that are conditional or overdue? And the answer is not all doses may be entered into care. If you haven't already, ask parents for their children's immunization records as well. If children are still missing doses, let the parents know when the missing doses are due. And there is a link in the slide to letter to parents for immunization needed. Next is, when should I use Squirrel? And the answer is, Squirrel should be used anytime you are unsure of a student's immunization status for school entry. If you are using a student information system that shows a student as complete, it is not necessary to again look for that student in Squirrel. And the last question is, where to get more information about Squirrel and resources? Here's a list of active links and resources, which include Squirrel fact sheet, instructions on registering in Care Hub to access Squirrel, website to log into Squirrel for already registered users, Squirrel user manual, FAQs, training video, school immunization laws webpage, and your local health department immunization program. So do check out these resources, and please remember that you should go to your local health department first if there are questions related to school immunization law. These links will also be shared with all the participants in a follow-up email as well. For any questions related to Care Hub or Squirrel, you can email us at carehub@cdph.ca.gov or call help desk at 800-578-7889. Thank you, and now I'm turning things over to my colleague, Ahana.
Thank you so much, Naveen. Next. Alrighty, so as for next steps, we had mentioned prior that we will be hosting office hours to go over a few questions that you may have entered during registration of this webinar, and also in the Q&A as suggested earlier on during this webinar today. But the dates for these office hours that will be held in May will be Fridays, May 12th, May 19th, and May 26th from 12 p.m. to 1 p.m. for all of them. The Zoom registration link is right here. So when you do receive that follow-up email from us, you'll be able to access those there. So you will, and then also you will, let's go back, please. Thank you. You will receive an evaluation link as soon as this webinar ends. Please feel free to enter your feedback in the evaluation, your most honest feedback. We'd really appreciate that. This will help advise content for future FAQs and Squirrel office hours scheduled next month in May. Again, the dates are right here in front of you, and we'd really appreciate that. Next. Thank you. And before we end today, I want to give a big thanks to our speakers, Catherine Flores and Cameron Lawton from CIC, Alana Hintz from M-Corp, Amy Pine and Naveen Magdum, and our school vaccination team here at CDPH working in the background to make today happen. Again, on behalf of our team at CDPH, I would like to thank all of you for joining us today. And with that, we will be now ending this webinar. Thank you and have a great rest of your day.